last one. So we have, I'm getting maybe a little bit of the tissue around the clavicle and underneath this way, but I also can maybe explore on the anterior aspect underneath the clavicle. Not sure if we're actually touching subclavius, but probably more from the posterior aspect. But the clavicular portions of the pec kind of working through this a little bit. You feel this?
Do.
Lacey is mentally tough. And I can just kind of push and leave it there as well. Let her normalize her breathing. The better we breathe and take our time with it, the better. Exhaling and pausing. Now what I'm gonna do is I'm gonna start to go in between the rib cage. So just find the space between the rib cage. I don't have to rub a lot back and forth. You can kind of find some spots by maybe rubbing in between. Small motions, and then I find that hurts. And I'm just trying to wiggle my thumb in between the rib cage and hold. Listening to her tissue, feeling it and just letting it do its thing. Digging in a little bit deeper each breath if she's able to. Maybe coming off of it during an inhale. Exhale. Gonna again dig in. Pause, don't breathe in. I'm having small excursions of finding the tissue next to the tissue I'm just on. And a little bit of shear. Good, I might spend a little more time on that one, but I'm gonna move on to a lower set. And she's gonna not like me for this one. Yeah. Good, and I would go through a sequence. I might spend 5 more minutes or so, maybe even more, 10 minutes there, and work through that. I work to the side through here on a female, under here, a little bit here, and males will be different.